session, we are going to be covering the general navigation of Amazing Charts PM. So that's how you access Amazing Charts PM. We'll also talk about the integration between the two systems. So if you're a current Amazing Charts user, which I'm assuming you all are, how it's now going to work once you are installed with Amazing Charts PM. And then the second half of today's session, we are going to discuss the administration table setup in ACPM. So there is some setup that is involved both on our end and the client's end prior to your installation with ACPM, and also some setup that may be required of you once you have actually been installed with ACPM. So right now I am on the main screen of Amazing Charts, which you're all probably pretty familiar with. Now you're working with your practice management implementation specialist to get everything organized for your go live. So that includes access to your environment. If your practice management implementation specialist has not sent it to you already, they will very shortly be emailing you a link to your database along with the usernames and passwords for those in your practice that are going to need to access Amazing Charts PM. We give all of our clients access to Amazing Charts PM prior to your install so that you can go in and do the necessary setup that is required prior to the install, and also to give you an opportunity to get familiar with the navigation of Amazing Charts PM and even register some test patients and do some practicing on your own so that you're ready for that go live. But keep in mind, this access that you're being provided is your actual environment. The only difference is it's not integrated with Amazing Charts yet. Once you are integrated with Amazing Charts, you will not have to use the link and those logins anymore to access Amazing Charts PM. You would then go back to the single sign-on process into Amazing Charts, and then there will be links in Amazing Charts that you will use. Jump over to Amazing Charts PM. So the first link is right on the main screen of Amazing Charts along the top here. So you can see it says ACPM. If I click on that, you'll now notice the screen has opened to my Amazing Charts PM area. So it's pretty instantaneous. Now, if I wanted to then jump back and forth from Amazing Charts PM to Amazing Charts and vice versa, once I have Amazing Charts PM open, down at the bottom of my screen, there is a little icon, and if I hover over the icon, you'll notice it says ACPM and Amazing Charts. So if I click back on where it says Amazing Charts, it jumps me back to Amazing Charts, and then I can jump back to ACPM. So that's how you're going to toggle between the two systems when you have them both open. The next way that you can access Amazing Charts PM from Amazing Charts is on the home screen. When you have a patient up in the patient list section and their name is clicked so that their summary information is located down at the bottom here, you'll notice there is a View Account link. If I click on this View Account link, it's going to navigate me over to Amazing Charts PM and into that patient's chart. So now you can see I'm in Arnold Allen's chart in Amazing Charts PM. And we go over the entire patient's chart in session 2. Next is if I'm in the patient's demographic screen in Amazing Charts, and we all know that there's a few ways to get into a patient's chart in Amazing Charts. So I'm just going to click on Arnold Allen, and here I am in his demographics tab. When you're in the demographics area of Amazing Charts for a patient, there will also be an ACPM link located over here on the bottom right. If I click on this ACPM link, it'll once again navigate me over to ACPM within that patient's chart. So the way that the integration works between the two systems is that it's comprised of the patient's demographics, the schedule, and also the billing piece. So from the demographics perspective, the two systems are bidirectional. So for example, if I was in Arnold Allen's demographics in Amazing Charts and I wanted to update his address, I can update his address in Amazing Charts, and when I hit Update Info, this information will also update in his chart in Amazing Charts PM. And vice versa. If I update Arnold Allen's account in ACPM, I would see those changes in AC. But as far as best practice goes, once you are integrated with Amazing Charts PM, all patient registration and chart management should happen in Amazing Charts PM. And the reason for that is there are some additional fields and key pieces of information that needs to be entered and updated at all times for patients in order to bill out of ACPM. And those links will not be available in Amazing Charts. For example, right now when you're in the patient's chart in Amazing Charts and you're in their demographics, over on the right, you have access to a billing info tab that stores the patient's insurance information. Once you are integrated with Amazing Charts PM, that billing info tab is no longer available to you. So you can even see in my database, I do not have that. Because all insurance information is managed in ACPM, because now that is your billing system. We also use accounts in ACPM for billing circumstances. Accounts basically store the responsible party information. It also stores the balances for the patient, as well as the applicable insurances that need to be tied to that account. And patients can have multiple account types if they're also seen in your practice for workers' compensation scenarios or personal injury, auto liability cases, etc. And these accounts get tied to the patient's dates of services. All of that is tracked in ACPM only. So we want to limit what you are doing in AC from that perspective so that your front desk is not getting confused and missing, those key pieces of information. So the next piece of the integration is the schedule. So for those of you that are currently using the schedule in Amazing Charts, the way that the schedule will work once you are integrated is it will become a view only. Because once again, all of your managing of appointments should happen in Amazing Charts PM. So that goes for booking appointments, rescheduling appointments, canceling appointments, check in, check out. All of that should occur in ACPM. And the schedule component is unidirectional. So it only goes from ACPM to AC. And you're going to learn also in session 2 all of the different tasks of the schedule in ACPM and how to manage that. And when you book a new appointment in ACPM or update an appointment, you'll be able to see that information in AC, because we do understand that there may be certain staff that doesn't need to go into ACPM for any purpose. They're more of your clinical staff, so they're just going to be maintaining the clinical documentation for the patient, but they may still want to be able to see who's coming in for the day. So that's why we still allow you to view the schedule in AC, but want all of the tasks to occur in ACPM. And then finally, the third piece being the billing piece. So the way that we expect the billing to occur once you are integrated with ACPM is for any dates of services that your providers are going to sign off on. The provider, when they are complete with the patient's encounter for the visit, will go ahead and click on the sign-off option on the bottom right of the encounter. And when they click on that, they're going to get an account information screen that will then allow them to code the level of the patient's visit and also select any additional CPT codes for that patient's visit. So this quick code area of the account information screen in AC is really an electronic encounter form. So it's a little bit for clients to get used to, especially providers, when they're used to checking off a paper encounter form and just handing it to the front desk or handing it to the biller to then enter at the end of the day. Now what they will do is they will click on the code under the quick code section. And for those of you that may not know where the quick codes are set up in AC, they're done under the administration option. So you will have to log into your administrator options section of AC. And then once you're in the administrative options screen, down at the bottom here, there is a Define Quick Codes for Billing link. If I click on that, it will then display the current quick codes that have been set up for my practice. And then from here, I could go in and add additional quick codes. The name is going to be the description of the code, and the code is the actual CPT code. Type is the type of code that you want it to fall under. And then add would add it to the list. You can also edit codes and delete codes. You have the option to put your codes in alphabetical order, or if you want all of your certain codes to be grouped together, such as vaccines or labs, you'll notice that I have numbers in front of certain codes. And by putting numbers in front of them, I can put along the top all my vaccine codes, and then on the second line, put my labs, etc. So that's how you're going to build your provider's electronic encounter. So once again, when they are signing off on the patient's encounter in AC, they'll be able to select those codes. And once they're complete with the selection of the codes, they will be able to see what they've selected down in this charge box. So they'll see the CPT codes they selected along with the ICD-10 codes. And the ICD-10 codes are going to pull off of the assessment of the patient's encounter. And then finally, when they click the Sign It, this is going to trigger Amazing Charts to take the charge data from that patient's encounter, and it will then transfer it over to Amazing Charts PM for the biller to then go in and review it at the end of the day, make any necessary changes to it, and then bill it out of Amazing Charts PM. And we talk about the billing process as a whole in more detail in session 3. So that's the 3 components of the integration between AC and ACPM. I'm going to go back over to ACPM now, and I want to show you where the help system is located. So in addition to the reference guides that you're going to get throughout your webinar training, you also can access our help system that's right in Amazing Charts PM. And there are 2 ways that you can access the help. Up at the top here, there is a little help icon. Some of you may have a little trouble seeing it just because of the color scheme of my environment, but it does say help and there's a little question mark icon. If I click on that, it's going to open up our help system in a pop-up. So you can access the help from anywhere that you're working in ACPM. And on the intro screen of the help, it talks about the integration between Amazing Charts and Amazing Charts PM. And then if I want to launch the user guide, I can click on this link up here. And it's now going to open up our help documentation. And our help documentation will automatically bring you to a table of contents page that breaks down the different topics in our help. And this is only our first version of our help system. We're going to, be updating this help guide periodically. So you can, of course, save this if you want, but I usually recommend accessing it directly from Amazing Charts PM in case there have been changes made to it. I don't recommend printing it because you'll see up at the top here, it is 423 pages. But it is a PDF document, so you could save it locally on your desktop in case you want to access it even when you're not launched in Amazing Charts PM. And then over here, on the left is where you can navigate to the different areas of the help. And we use the concept of the tree, so you can click on the plus sign next to one of the topics, and it will expand and show you all of the additional topics within it. And most of the areas of the help include additional links that are highlighted in blue for you that'll bring you to different areas. And also a lot of it includes screenshots so you know exactly how to complete a task. So in addition to the help link up here, I could also go over on the left-hand side of ACPM where you see this purple column. And if I right-click, there's also a link to our help topics. So it's really up to you which way you prefer to access it. So Amazing Charts PM is broken out into 6 different sections: front desk, bookkeeping, billing, reporting, administration, and support. And the way that it was designed was to mimic typical practice workflows. So the front desk is where you will see the typical front desk tasks in a practice. So that would include searching for patients, managing appointments, recalls, and other miscellaneous front desk tasks, such as patient registration, referrals, prior authorizations, printing a paper appointment list. And we cover front desk entirely in session 2. And then the next link is bookkeeping. This is used by the billing staff to do payment posting in ACPM. So we cover the bookkeeping area of ACPM in session 4. Billing, of course, is another billing link. So this is where the biller will batch up the charges at the end of the day, validate them, and transmit them to the clearinghouse for further processing. We exclusively use Claim Remedy as our clearinghouse. And all of our clients get direct access to the clearinghouse so that you can check on your claim status for your claims and also potentially work any claims with errors. In billing, you can also manage patient statements and your payer response reports that you get back from the insurance carriers when they've received a batch of claims. The billing link is covered as a whole in session 3. Reporting is just that. It's where all of the Amazing Charts PM reports are located. So all of our reports are broken down by type. All of our reports are formatted in PDF at this time. And although we do not do custom reporting, depending on the report that you are running, all of our reports do have filter options that you can use to customize your reports in some way. You also have the ability to save reports up to 3 months. And of course, if you save your reports, you can also choose to save them indefinitely before they expire. Reports are covered also in session 4. And then the last link is the administration link. So administration is where we're going to spend the second half of today's webinar. And this is where the build and the customization happens for all of our practices. So the good news is we do the majority of the setup for your practice under the administration section. And for those links that you will need to set up or customize, we make sure that we provide all of the necessary instructions in the reference guides for these webinars along with the help system. And just to point out support, you will not have to go into support at any time. This is just used internally by your Amazing Charts team in those cases where we need to do certain setups or customization for your practice. So all of these links under the administration area of ACPM store information that is then accessed from the other different areas in the practice management system. So anywhere in ACPM that there is a drop down, that information is pulling based on how the table was set up in administration. So I'm going to start today in the administration by talking about those tables that you will want to complete prior to your install with ACPM. The first table is located under the Advanced Setup. And the reason why I'm starting down here is because a lot of these tables are dependent on one another. So if the information is missing or incorrect on one table, it can impact the setup of another table. So I'm starting off down here under Advanced Setup because the billing agent table is actually going to pull into another table that I'm going to cover next. So the billing agent table is where you're going to store the entity that does the billing for your practice. So if you have a billing company that does your billing, you'll come in here, hit Add, as located on the bottom left of the administration, and you're going to add your billing company's information. All of the tables in administration have codes and names. The code is going to be the abbreviation of the name that you're going to be entering. And these codes are used in the system where the drop downs are located. So if you are more of a keyboard person versus a mouse person, instead of clicking on the drop down and selecting the name, you can type in the code where the drop down is located and pull in the information by code. So I usually tell clients, just make the code abbreviation of your name. So my billing company is Amazing Charts, so the code I'm using is AC. You'll also notice that there are effective dates throughout Amazing Charts PM. And in most cases, effective dates are really only used when you need to deactivate something. So I'm going to leave my effective dates blank for my billing agent. You'll want to put in the address for your billing agent. And most areas of the administration setup where it asks for a zip code, you will be required to put the last 4-digit zip code extension. And I do indicate that on the reference guides for today so you don't forget. And then the contact name. So that could be the administrator of your practice or the head provider, so who is the main contact. And this contact name will actually be put in other areas of the administration. Employer ID can be left blank. And then you can put the phone number, fax, and email of your billing company. Once this information has been entered, the save is located on the bottom right, or we have some quick keys that you can use. So again, if you like your keyboard, you could hit F2 instead. If your biller is in-house or it's just an independent contractor, you could either put that billing person's name, or you could just put the name of your practice. So once you've entered the billing entity and saved that information, you can X out by going to the top right corner and hitting the blue X. And next, we're going to go up to the table management section of administration and click on the practice table management link. This is where you're going to set up your practice specific information. When you come in here, you're going to notice that your practice code and description has been set up for you already by your practice management implementation specialist. And it's going to be in gray because it cannot be altered by the practice. If you notice that it's incorrect or something is spelt incorrectly, please notify your practice management implementation specialist. But you'll want to come in here and put your practice's address along with the last 4-digit zip code extension. Here's that contact name again, phone, fax, email if you wish to do so. If you bill as a group, you'll want to put in your federal tax ID. If the area that you're located in has a state tax ID and or local tax ID, you can put that in there as well. Employer ID will be left blank. MPI, again, if you bill at all as a group, you'll put your MPI in there. And then your primary taxonomy code for your practice. And then here is where you're going to select the billing agent that we set up in the previous table. It's very important that your billing agent is linked to your practice for billing circumstances. And then you can leave the default statement, default receipt, and default demand strategies at their defaults. And then there is a default area code box, so if you wish a certain area code to populate in ACPM wherever an area code displays, you could put that in here, or you can leave it blank. And the payment application order, you will leave that at charges for today's first. Once you've updated your practice table, again, you're going to hit save on the bottom right and update that information, and then X on the top right corner. The next table that you would want to set up, and this may or may not apply to those of you on the call, is the county table. So if you are located somewhere that you track the counties in which your patients reside in, you'll want to come into the county table, hit add on the bottom left, and give an abbreviation of the county and the description of the county. And hit save on the bottom right. And you'll want to do that for each county that you're going to track for your patients. And you'll see in session 2 where this county pulls in on the patient's demographics. The next table is probably one of, if not the most important table. It's the plan table. So we do load 1,200 global insurance plans in all of our practices databases. And prior to your install with ACPM, you do not want to change any of that default information that we've loaded into your practice, because it is used during your install to migrate your patients' insurances over from AC to ACPM. But what you do want to make sure that you're working on prior to your install is entering the applicable addresses for the insurance plans that you're going to use. We do not load the addresses, and even though you may bill electronically, the addresses are still required to be attached to each one of the plans. So I usually recommend starting with the top 10 to 20 insurance plans that you use in your practice, and you may not even use that many. But if you do, start there, and you can usually find out by running a pretty basic report in your other PM system to find out, what those top plans are, or you may even just know from experience. And usually your previous PM system should also have the addresses that you will need to input in ACPM. If not, you can usually get the address off the patient's insurance card. So if you make photocopies or you scan in a copy of the back of the patient's insurance card, you can usually get the address there. So you'll want to come into this table, and I recommend using the Show Advanced Search option that's located on the top right corner to search and locate each one of the plans that you're going to be looking for, because our scroll for our plan table ends at Blue Cross Blue Shield Nevada. Just due to the amount of insurance plans that we load, it can't scroll all the way through the 1,200. So if you need to locate a plan after Blue Cross Blue Shield Nevada, you'll have to use the Show Advanced Search option. And you're going to see the Show Advanced Search option in a lot of different areas, not only of administration, but Amazing Charts PM. And the Show Advanced Search allows you to put in specific criteria in these filter fields so that you can locate specific information. So you'll see here, if you happen to know the code, which you probably won't, you could put in the specific code for the insurance plan. But you'll probably, more often than not, search by description and or carrier type. So if I put in the description, just Aetna, I can then hit F2. And after I hit F2, you'll notice the screen refreshes and it shows me all of the Aetna plans that have been preloaded in my environment. So once you locate the Aetna that you use, you can click on it, and whenever you click on something in this box up here at the top, it'll highlight it in purple and display the specific information pertaining to that at the bottom, and it's already in an editable format for you. So I could just simply go to the address field, click into it, and then enter in the address information. And I'm just putting in a dummy address. And then once that information's been entered, you could also put in a plan phone if you wish to do so. I usually recommend putting in a phone number because this information will actually populate on certain reports. So when you need to do billing follow-up, it'll indicate the plan phone number so that you could actually call and follow up on your claims. And then once you enter that information, hit save on the bottom right, and it will store that information for you, and then you can go back up and locate your next insurance. And again, I do have all of this outlined in today's reference document for you as well. The next couple of tables I'm going to discuss are the procedure table and the diagnosis table. So again, we load pretty much all of the procedure and diagnosis codes that you're going to use in Amazing Charts PM. But we, of course, aren't going to load any dummy procedure codes that you may use. So if you have house codes, for billing no-show fees or medical record requests or retail services in your practice, you're going to want to come in, and I usually recommend to do this prior to your go live, and add those house codes. And it's pretty straightforward. You come into the table, hit add on the bottom left, put in the code convention, the description, and then this would be the actual CPT code that you would use for billing. And then once that's been entered, hit save on the bottom right, and it will save your code. Additionally, you have an on-site lab. You have a CLIA number, and that CLIA number will need to go out on any lab codes that you bill for your location. So you'll want to make sure that you come into the procedure table and locate those lab codes. And again, I usually recommend using the Show Advanced Search. And then where it says search for code, locate the lab code. And then once you locate the lab code, once you select the lab code, where it says type of service over on the left, you want to link those codes to diagnostic laboratory. Also, if you bill injection codes that are going to require the NDC to be attached, you'll want to come in here and locate those injections and enter the NDC code for those injections. And then hit save. The diagnosis table, I usually recommend for those circumstances where you're going to need to bill house codes that you just enter a basic miscellaneous diagnosis code that would tie to any CPT codes that you bill out of the system. Because every CPT code requires at least one diagnosis to be linked, and this miscellaneous code fulfills that requirement. The next one that you're going to want to set up is the service location table. You'll want to make sure that all of the service locations that you're going to be billing out of ACPM for and also scheduling at are located in the service location table. Your PMI will most likely put your default office location. I usually always recommend, though, coming even into your office location and making sure that they didn't miss entering any information and that the address is correct. And also, of course, if you have a CLIA number for a location, this is where that will be entered, and also the MPI applicable to the location. And then, of course, if you're going to be tracking appointments or charges for hospitals or nursing homes or any other service locations, you're going to want to enter those here. And then the next table may or may not apply to some of you is located under the billing administration. It's the charge program table. The charge program table is where you would set up your sliding fee scales if you use those in your practice. So if you use sliding fee scales, the charge program table is just where you're going to set up the naming convention. So you'd come in here, again, give it a code and a description, save it. And once you've set up the naming convention under charge program, you would go down to the sliding scale setup, also located under billing administration, select the program, and then enter the specifics for that program. So those are the tables that you're going to want to make sure that you've set up prior to your install with ACPM. There are certain tables that are going to get populated during your install with ACPM, and that information pulls over based on what is set up currently in Amazing Charts. So what you'll want to make sure that you do is go into Amazing Charts and update or make sure all the information is accurate prior to your install. So the first one is the provider table. Your internal and external providers, if you do have referring providers, are going to pull over from Amazing Charts. So you'll want to make sure any providers that you have set up in Amazing Charts are updated. So if you've had providers leave your practice and you don't want them to come over, you want to remove them from your user preferences in AC, or you can have them come over and then you can just deactivate them out of Amazing Charts PM, and also your referring providers. And then underneath the appointment scheduling area of ACPM, the resource table. This is also going to pull over from Amazing Charts. And of course, in the circumstance that you use the schedule in Amazing Charts. So if you have a schedule set up in Amazing Charts with the resources, and that could be your providers and also certain equipment rooms, all of that will come over during your install. And of course, if you needed to add additional resources, one of the handouts for today is the appointment scheduling PowerPoint that goes over how to set up additional resources. And then the next one that's going to come over from AC is your reason table. And this is your appointment types. So all the different appointment types that you currently use in Amazing Charts will come over to Amazing Charts PM. And then of course, after your install, you can add additional appointment types. Or if you have to go in and maybe change some of the naming conventions of the appointment types that came over from AC, you can go ahead and do that. What's also going to come over are the durations for your appointment types. So if your follow-ups are set up as 15 minutes in AC, they'll come over as 15 in ACPM. So we'll meet established patient and any other appointment types. Also, if you have your fee schedule set up in Amazing Charts, that will also come over to Amazing Charts PM. So your fee schedule that's going to come over from ACPM pulls from your CPT database under your administrative options, modify codes and fee schedules, and it's your practice CPT charges. So if this is already set up in AC, this information will pull over to ACPM. If you don't use the charges in AC, but you can get a text file of your charges from your current PM legacy system, you will be able to send a file over to your PMI and we can import it into Amazing Charts PM. So that's something that you will want to discuss with your practice management implementation specialist during your next weekly or bi-weekly call. If your charges are not currently in AC, but you can get them out of your current PM system, speak to them about that, and they will tell you the format it's going to need to be in order to import those. And then once they come over, they'll be stored under Billing Admin Usual Charge Schedule. We also have a payer fee schedule, but it has limitations. These payer fees that you set up here have to be done manually, and these will not show up on the charge screen. They're only used in circumstances where you do manual payment posting for that carrier. So usually I tell clients, if you're going to put in payer fee schedules, it's really going to be more for storage purposes if you need to refer to the payer fee schedule rather than using it for reporting and tracking. So under the schedule templates link, this is where you will set up the availability for your providers and resources in ACPM. And again, this is covered in one of the PowerPoints for today. In here, you'll go in and add the code and the description of the resource that you're creating the schedule for. So you can see my example is Dr. Smith. The start month and start day of the month will be the same for all of your resources, 1/1. And then the days of the week will correspond based on how you want the schedule to show in the book screen. Do you want it to start on a Monday, so day 1 will be a Monday? Or do you want day 1 to be a Sunday? If you want it to be a Sunday and your providers and resources don't see patients on Sundays, you'll want to make sure that you leave day 1 blank. And you just fill in day 2, day 3, day 4, day 5, day 6, and then day 7 would be a Saturday. And again, you would leave that column blank. And then in each one of the boxes, you would put in the time increments. So when your provider resources starts to see patients in the morning, and when they stop seeing patients in the morning, you can leave out your lunch break, and then you can put in the afternoon availability. And what's nice about this screen is if it's the same for multiple blocks, you can highlight the time increment, hit Control C as in cat on your keyboard, and then go to the other boxes and hit Control V as in Victor and paste that information. And then the weeks is just the weeks of the month. So, which weeks of the month that these days correspond to. And then when you're done entering that, hit Save on the bottom right. And you'll do that for each one of your resources. And then the resource schedule is where you tie everything together. So the resource schedule is where you're going to select the different resources that are going to pull over from Amazing Charts during your install, and then link it to the schedule template that you created, and then the location that that resource and template should be linked to. So of course, if you have multiple locations that you're going to be scheduling appointments under, you'll have multiple templates and multiple resource schedules because each one is going to tie back to the specific location. And then the start date ties back to the days that you've set up under the schedule template. So if you decided that day 1 was going to be a Sunday for your providers, you want to make sure that your start date is a Sunday here. Or if your day 1 was a Monday, make sure under your resource schedules that the start date is a Monday. And then the end date is however far out you want to build your resources availability. Maybe you build out a year in advance, 2 years in advance, etc. And then you'll notice that there are some overrides on this screen, but this is kind of the old way that you set up overrides in administration. You're going to learn in session 2 the best way to block and unblock your schedule. And then the view templates is where you set up the different views for your schedule. So you have the ability to tell the system that when you are viewing your schedule for the day that you want to view all resources at once. So you could set up a template name called all. And then the start and end time is going to be, when your office opens and when it closes. And then what information do you want to see for your patients once they're booked in an appointment slot in ACPM? And you can see all of the different demographic options in this list. And you would just check off next to the ones that are applicable for your practice. And then under the resource and locations is where you would link the resource and the applicable location that you want to tie to this view template. And then, of course, if you want the ability to tell the system that you want to just look at one provider or resource at a time on the schedule, you can set up additional view types that would just be linked to the individual resource or provider. And I'll refer back to this in session 2 so you can see how this all ties together. And I also provide some screenshots in today's reference document for appointment scheduling. So again, how you can see how this all ties back. And then the last two options are the different color coding that you can do in ACPM. The appointment display scheme allows you to color code the different appointment statuses that you use in ACPM, along with your different appointment reasons that are going to pull over from AC. So you can color code these different statuses and reasons so that when you view that status or appointment reason on the schedule, it will show up in the color that you've created. You can also even color code eligibility responses. So for patients that come back with an eligibility status of not eligible, maybe you want them to default in a certain color if eligibility is very important for your practice. Most people just color code the statuses and the reasons. And then the calendar display scheme is where you can color code the headers of your resources schedule columns and what you want your available and unavailable colors to be on your schedule. And you can set up this differently by each provider and resource, or all of your providers and resources could have the same color convention, but you're allowed to customize that. And if you do opt to use any of the color coding features, they also get tied back to the view template setup. So you'll see on the view template screen that there is an appointment display scheme column and a background display scheme column. The appointment display scheme is the status and appointment type colors. The background display scheme is the calendar display scheme. I don't know why it doesn't say calendar display scheme here, but that is what it would default to. And then as you go through your training with Amazing Charts PM, I will refer back to a lot of these additional links located under administration because some of these links, even though we set them up for you automatically, you can go in and customize them further. So you can, remove some of the information that we add if it doesn't apply to your practice. Or you can even add additional information